presentation and question and answer session will inspire you to apply for nursing here at Ulster. So I'm the academic lead for the pre-registration undergraduate nursing programs here at Ulster University in the School of Nursing. And I'm joined today by Shauna Dugan, my colleague, and Shauna's an academic lead along with me, and she deals with practice learning because, as you'll see, 50% of our programs at Ulster in our School of Nursing are based in practice. Hopefully on the line or in the webinar as well is Claire McGlone. I know Claire was having some technical difficulties this morning as well. But she is the Associate Course Director and will be the Course Director for the Mental Health Nursing Programme, and she's joined by Sinead Rocks, who is a first-year student in Mental Health Nursing Programme. And we may have Bernie Reid in our webinar as well this morning, and she's the Course Director for the Adult Nursing Programme, and she's joined by Emily Howe, which is another first-year student on the Adult Nursing Programme. So we'll be very happy to try and answer your questions as we go through the webinar. So do feel free to type in any questions that you have as we go along. So the first thing I just wanted to talk about was what is nursing, and I think this is very apt at this time that we're in with COVID-19 and everybody in lockdown and all the pressure that our nursing colleagues are under. So I was just going through some of the images of nursing that you've probably seen recently on media and news channels, and you probably have seen nurses portrayed like this. So in full personal protective equipment at the minute, dealing with the coronavirus and trying to keep their spirits up as well. So this is very much the image of nursing that you are seeing at the minute. And if you looked maybe 2 or 3 months ago for images of nurses, you probably wouldn't have seen very many images like this. Now, nurses are trained in PPE and they've worn PPE for other situations, but not as much as we're seeing now. So this is kind of the current image of nursing. So I just want to talk a little bit about this morning and try and put into perspective what these nurses have done to get them to this stage, and it'll be great for you to be able to speak to our nursing students as well. You probably heard words like nurses as heroes and angels, and that sort of terminology being used, particularly recently on news bulletins and everything. You don't often hear that nurses are highly educated. All nurses are educated to at least degree level. So all nurses have a degree, and many nurses are educated further. They choose to go on and do masters in nursing, masters in health, and many nurses go on and do doctorates. They do PhD, they take a research route, and they have PhDs. So behind those pictures are highly educated, highly skilled professionals. And that's the key thing. Nursing is a profession. Nurses are critically thinking, highly skilled professionals. Most of them will have taken at least 3 years to become a qualified nurse. So 3 years of studying at degree level and third level higher education to become a nurse. And many of them will take longer than that. Once you start your nursing career, you are continuing in your education and you are learning for the rest of your career. Many nurses are leaders in healthcare. So they are the ones that innovate and that drive change in healthcare for their patients. And many nurses are sitting at policy level and helping make policies for the population, influencing policy and shaping healthcare. So it's not just about being heroes and angels. Behind those images that you're seeing are highly educated, highly qualified, highly trained professionals. And it's very important to remember that. Nurses enable people to achieve the best quality of life that they can. They enable people to improve their health. So they're involved in health promotion, in health education, in keeping people healthy, keeping the population healthy. They also help people to recover their health, so recover from illness, and to do that with care and compassion. They help people to manage their own health problems. So if someone has a long-standing health problem or something that can't always be cured, nurses help and support people to manage those health problems and to try and achieve the best quality of life that they can living with that health problem. And then they help people to maintain their health. And at the center of all of this is a person and their family. And that's the key thing about nursing. And nurses, they keep the person at the center of everything that they do and involve the person in making decisions about their own health and about their own life. And this impacts on family members, and nurses involve the family in that care as well. So a little bit about nursing at Ulster University. Why would you want to study here at Ulster? Ulster University is unique in that we are a 4-campus university in Northern Ireland. So we're across 4 different campuses spread out across Northern Ireland. We have a campus in Belfast, a campus in Jordanstown, a campus in Coleraine in the north of the province, and Magee campus in Derry in the west of the province, which is what you can see in the photograph there. Our undergraduate nursing programs are based here at this campus, the Magee campus in Derry, and we do a lot of postgraduate courses, education and research. A lot of our postgraduate courses are based on the Jordanstown campus, just outside Belfast. The School of Nursing is one of the leading schools in the UK. We're very student-centred and student-focused, and our nursing programs are based on a person-centred framework, which we'll talk a little bit about later. We have outstanding teaching quality, and again, you can speak to our students about that, and I'll mention a little bit about some of the methods of teaching that we use. And we have a very good employability within the university, and within our nursing programs, we have a very high employability rate. We're at 100%. And again, our research, we're very strong globally in our research, and many of our nursing students have gone into research, and our alumni are in research, and we have a strong research centre within the School of Nursing. This is very timely this week, because you may or may not be aware that Tuesday, the 12th of May, Tuesday just gone, was International Nurses Day, and the World Health Organization has actually declared this year as the International Year of the Nurse. And it's very poignant for us at Ulster University, because this year we are also celebrating 45 years of nursing at Ulster University. So we're celebrating a lot of things about nursing at Ulster this year on social media, and so you can follow us on Twitter and Facebook. This photograph is some of our previous students. These people have all qualified last year. This was a photograph taken outside the Magee campus in Derry, and I don't know if you can see, but there is some writing on that picture, and it's actually the signature of Florence Nightingale, which is in the visitors book at the Magee campus. She visited Magee College as it was then, and her signature's in the visitors book there. So that's something that we have a great connection with. So nursing at Ulster, as I said, we've been here 45 years, and we were actually the first degree course in nursing on the island of Ireland. Our School of Nursing is ranked as 7th best in the UK, and we're in the top 50 in the world. And we work very hard to maintain that ranking. Our student satisfaction rate is above average, and that's in the National Student Survey, which takes place every year, and we always score very high in that. As I mentioned previously, 50% of our undergraduate nursing programs take place in practice learning, and we've been rated as outstanding for our practice learning. We're very proud of our partnership that we have with our clinical partners, our trust colleagues. So these are the people out in practice, and they work very, very closely with us to produce our program and to support our students. And we are leaders globally in our nursing and research and teaching. And the programs that we offer at Ulster are our BSc Honours Nursing and Mental Health and our BSc Honours Nursing and Adult. So adult and mental health nursing are the two programs that we offer at undergraduate level at Ulster. These programs are both 3-year programs, and they're a full calendar year, September to September. So you're either in class or on practice learning all the time throughout the year. 50% is based in the classroom, as I said, theory. So that's when you'd be on campus normally, in normal times, on campus, the Magee campus, in the classroom, learning theory, being taught. And then the other 50% is based in practice learning experiences, and that can be in a variety of experiences in hospitals across Northern Ireland, in community placements, and in nursing homes. We mainly place our students in practice learning areas in the western and northern part of the province. So from White Abbey, Coleraine, Derry, Enniskillen areas. There are, on our programs, written into our programs, there are opportunities for placement outside the UK, and our curriculum is based on the person-centred framework. So everything that we teach and everything that we base our curriculum on for nursing is based on a person-centred framework. When you're studying with us, you will learn about the person-centred framework, what that is, what person-centred nursing means. You will learn about professionalism, what it is to be a professional, what accountability is and what that means. You'll also learn about research and evidence. So research is very important to us, that we're questioning practice, that we're driving practice forward, and that all the practice that we do is based on the most up-to-date recent evidence. So we're making the best decisions possible for our students. You'll also learn about how to assess a patient, how to plan care for a patient, and of course how to provide that care to a patient or person, and how to evaluate that care. How well has that care been for the patient? How do you evaluate that? You learn about anatomy and physiology, about health, what health is, what ill health is. You learn about mental health and physical health of the person. You will also learn about public health and population health, and as I mentioned, health promotion and health education of people. You learn about ill health and disease, so that's called pathophysiology, and some of the science parts of nursing as well, about microbiology, infection control, of course, which everybody's learning about now in our COVID-19 times. So that's always been a cornerstone of nursing and of our courses, and it's a very, very important part of that. Medicines and pharmacology form a big part of our course, and that would be very important as well. And you'll also learn about nursing procedures, you know, how to carry out nursing tasks safely and ensuring dignity of the patient as well. For September 2020, we have rewritten our curriculum, and we have been submitted for approval for that to the Nursing and Midwifery Council, who are our nursing regulator. So they oversee our courses, and they approve our courses as well. So how we support your learning when you're here with us at Ulster, we use a variety of techniques and approaches to our teaching. We use role play, so we have different types of role play that we get you involved in as a student. And again, some of our students can talk about this and their experiences of this. So this tries to provide the more realistic side of nursing, while ensuring that we have a safe environment for you to do that in as well. We have great practical skills areas and suites within the university. So we have in our skills rooms, we have set up hospital type environments, patient's home environment, where you can simulate and go in and practice nursing procedures and skills in a very safe way, and you can be supervised while you're doing this as well, so that you are confident and you have practice at a skill before you go out into your practice learning, to be able to do this on a real person. We also deliver our teaching through lectures, seminars and workshops. So lectures would where there would be more students in a lecture theatre or in a classroom, and then seminars, tutorials and workshops are where the student group, you're in smaller student groups, and there's more time for discussion and debate in seminars and workshops. And then we have simulation, where again we can simulate real life situations and put you in situations where you have to react and use your skills of communication, your clinical skills, your nursing procedures that you've learned along the way. So we can do this with life support courses that we do. We also do simulation through a major incident event or a major disaster event that we run on the campus every year, and students are involved in that, acting as nurses, taking decisions, and some of our students act as casualty actors in that simulation event as well. Obviously, we use online learning, and we've been doing that recently with our students. So our programs are ongoing, and we're continuing to teach our students through online forums, and that's through lectures and smaller group tutorials as well. And we'll continue to do that throughout our programs. So applying for nursing at Ulster, just wanted to talk a little bit about the application process and what you need to do to, if you're thinking of applying for nursing at Ulster University. So how it works, the Department of Health in Northern Ireland commissioned the places on our undergraduate programs, our adult program and our mental health program. And the numbers are reviewed every year, and the Department of Health make the decision on how many places we can offer. So for 2020, they have commissioned 343 places on the adult nursing program and 84 places on the mental health nursing program. And that's an increase from last year. So they've actually increased the number of places for our September 2020 intake. You may be aware there is a global shortage of nurses, and within Northern Ireland there's a shortage. Pre-COVID there was a shortage of almost 2,500 nurses within Northern Ireland alone. And as I say, there is a global shortage of nursing, and once you have a nursing qualification, you can, it's recognised globally. Your qualification from Ulster is recognised globally as well. So on completion of your course with us, your degree, you will receive an academic award and a professional award. Your academic award will be a Bachelor of Science with Honours in Nursing from Ulster University, and that will either be in adult nursing or in mental health nursing, depending on which field of nursing you choose. And your professional award will allow you, that means that you can register as a nurse, a registered nurse with the Nursing and Midwifery Council UK, and they are the regulators of nursing within the UK. And you need to be registered with the Nursing and Midwifery Council in order to be able to practice nursing in the UK and in Northern Ireland. Current employability is at 100%. So all of our nursing students who have graduated will get employment. The majority of nursing of our graduates, and that should be graduates there, will take up employment in Northern Ireland. Some nursing graduates choose to go abroad for further experience or for personal reasons, and we support them in doing that, but the majority of our graduates take up employment and get employment within Northern Ireland. The application process, applications are submitted via UCAS system. As you can imagine, we have a high number of applicants for our programs, both our adult and our mental health nursing programs. In 2019, we had over 2,000 applicants. And obviously, so we have to have a selection process for that, because we don't have 2,000 places, unfortunately, on our courses. So we have to select. So we use your personal statement that you have to submit as part of the UCAS application. We use that personal statement to help us shortlist and invite people for interview. So when I'll talk a little bit about your personal statement shortly, but we will invite almost 1,000 applicants to interview across both the programs. Entry qualifications, I think that I've said 280 UCAS tariff points, but I think with the new system, the weighting system, that's changed to 112 UCAS tariff points, and that should include GCE A-level grades at B, B, C, or an acceptable qualification. GCSE requirements are maths, English, and single award science at grade C or equivalent. And there are other acceptable qualifications as well, particularly through access courses. And a lot of our students come through this route, through the access course. So ILC, BTEC, HND, HNC, and foundation degree are all acceptable. Now you can find out more information about the entry requirements by contacting our admissions office, and they will be able to give you more information on specific entry requirements or equivalencies as well. In addition to that, once you get through a successful interview, it's important that you have a satisfactory occupational health assessment, and that's a requirement to enable you to go out into practice part of the program and enable you to be safe in practice, and also an enhanced police check with Access NI. So you make your application through UCAS. That's the course codes for both the courses, B740 for BSc Honours Nursing Adult at McGee, and B760 for the BSc Honours Nursing in the Mental Health Programme. The closing date is usually the 15th of January each year, and this is strictly applied, so any applications after that will not be considered. And applicants should follow the UCAS guidance to ensure all required information is included in your application. Important thing the admissions office here at the university always say is to make sure you have your correct email address and one that is current, because all communication will be via email. So just be aware of that. If you're using a school email address, sometimes they can kind of be deleted or become obsolete once you leave school. So you need to make sure that you have an up-to-date personal email address as well for information and communication with our admissions office at the university. Just a little bit about your personal statement. Your personal statement is your opportunity to highlight why you want to do our courses and why you should be offered an interview. Because bear in mind that we do screen all the personal statements to select applicants for interview. So it's the first step, it's a very important step in the application process. So take time to think about your personal statement, take time to write it, make sure it's accurate, and follow the UCAS guidance on how to write a personal statement. Try and keep it personal. It should be about you, but it needs to be relevant to the course that you're applying for. So we like to see that you're applying for nursing and that's reflected in your personal statement. As you can imagine, if we have got 2,000 applicants, the ones that are going to stand out for us are the ones that you know, really show a desire and a passion to do our nursing courses. And that means that you know about the course that you're applying for as well, and that you know why you want to do that course. So showing understanding of the course and the profession that you've applied for. Be clear about why you want the course and show what you know about it, and show relevance to your achievements. So rather than listing your achievements, when you're writing your personal statement, try and say what you've learned from these achievements, what skills, what insights, what knowledge you've gained from these, and how these can be relevant for the course that you've applied for the profession. So how they can be relevant for nursing. Funding for our courses, as I've mentioned, all places are commissioned by the Department of Health. So they pay the university tuition fees directly to the university. In addition to that, there is a non-means tested tax-free bursary, which is $5,165 per year for each year, and that's paid in monthly instalments, which is £430.42 per year. This is reviewed annually, and if you've had a bursary before, you may not qualify for it, but again, you can find more information about the bursary again from our admissions office. You're not eligible for a student loan or student grant if you're in receipt of a bursary. So you can find out more about nursing at Ulster, and I'm just going to put up some of the events that we run throughout the year. We have our open days for the university, and nursing is always represented at those open days across all campuses. So we have representation at the Jordanstown, the Coleraine and the Magee campus for those open days. And they're in September. I think it's the 19th of September this year, but keep an eye on the university website for the dates for that. The School of Nursing then have an Insight to Nursing evening event that we run usually in October. We don't have the date confirmed for that yet, but it's usually around the 14th, 15th of October. That usually takes place physically on the Magee campus. And again, this year, we will have to just wait and see how that pans out, if we can be physically there on the Magee campus. If we can't, we will run a webinar similar to this and focus on nursing, and again, we'll have students there that you can ask questions of, and more staff. Details and registration for the Insight event will be on the School of Nursing webpage. And this is a brilliant opportunity for you to obtain more information about the courses provided at Ulster. At our Insight event as well, we usually have representation from the admissions office, so they can answer some of those questions around admissions and what you need, your entry qualifications and criteria as well. And there'll be plenty of time to ask any questions that you have, or any new questions that you may have at the Insight event as well. I think for further information, you can contact myself. My email is there. Shauna Dugan, you can contact her for any issues around practice learning or any aspects of the course that you're not sure about. We also have our admissions office that you can go on and look on their webpage, and there's an email address as well. I think it's @admissions@Ulster that you can contact them. And we have a school webpage where we put information up about our events, and we also have quite an active social media page or Twitter page. It would be great if you could follow us. The hashtag Ulster Nurse is often used as well. And we've put a lot of information about what's going on in the School of Nursing on our social media pages. And I think that's probably the end of our presentation. So if anybody has any questions, I'd be very happy to take them. And I think it's probably important at this point, just when I have this picture of students there, that I introduce you to our two students, and Emily and Sinead, and maybe I can start by asking them some questions, if that's okay. So Emily Howe is a student nursing, first year nursing student in on the adult nursing program, and Sinead Rocks is a first year nursing student on the mental health nursing program. They're coming towards the end of their, well, they're over halfway through their first year at Ulster University, and their first year on each of their respective programs. And they've been, their whole program has been thrown into chaos with the COVID-19 and the lockdown, and our students have coped tremendously well with that, and they have been planning to go out into placement, and haven't been able to go into placement, and have had to study further and start their second year early. So there's a lot going on with our first years. And just to mention, we're currently preparing our second year nursing students to go out into the workforce now, and out and onto their placements at the moment. So we're doing a lot of work with our practice partners to prepare our students to go out. And just to say, our third year nursing students have been out on placement now, on their extended placements for 7 weeks now. So they are on the front line and working in all areas out there in practice as well, and helping the workforce, you know, manage the current situation that we're in. And they're doing a fantastic job, and we're getting really, really positive feedback about our third year students that are out there helping the workforce. So I could just start maybe by asking Sinead and Emily why they wanted to do nursing, and how they found the whole process, application process of applying.
Well, I'm Sinead, and I do mental health nursing. So I originally knew, obviously, for ages that I always wanted to work with people, and that was really no matter what it was. And then a family member got sick, and it was physical, but immediately noticed the impact of mental health within that, and seen the importance of the nurses and what they were doing, and just knew that that was what I wanted to do immediately. And obviously realised, like, looking at it, it wasn't like a normal uni course, and it's not. It is tough to get into, and every stage is really vital. You know, your personal statement, it has to be all about you, and it has to be about nursing. You know, it has to be, why do I want to do nursing? And then once that stage was passed, it's getting the interview, and you know, the interview's tough, and I don't want people going in thinking, oh, I don't have all this work experience, I don't have this, you know. All I really had was caring for that family member. But it's showing your potential and your willingness to learn, and do your research for the interview, you know, keep up to date with the open nights and the insight evenings, and go to the webinars and look at the prospectus, you know, utilize your careers teachers at school and the careers service. All of that will help you, you know. And it's such a good course. Like, I can't even describe how good of a course it is, but it is tough, but it's so, like, the rewards you get back is just unbelievable. Like,
Brilliant, Sinead. Thanks for that. And what about you, Emily, in terms of the application process and why you wanted to do nursing?
Yeah, I would absolutely agree with Sinead. Like, my mum's a nurse and my dad's a paramedic, so it runs deep in our family. And I just used to watch them and how dedicated they were to caring for people, and that was just so evident that they just really wanted to look after people, and I think that was instilled in me. So I did always want a job within a caring profession, but I wasn't sure what. And then I started working in a care home and I loved it, but I wanted to do more. I wanted to be more hands-on. So yeah, I applied for McGee, and I really did put all my eggs in one basket because McGee was where I wanted to go. I looked at the course. I talked to people who had done the course beforehand, and it just the prestige that comes with it. You know, there's tutors are so dedicated, they're so knowledgeable, like in all their fields and their research, and they really are passionate about nursing, and that was what, you know, that's what keeps me going, because anytime I'm having a tough time, I know my tutors are there to help me, and that is so important. And with the process, I went through the Access and I Higher Education course, and that really kind of gave me a good platform, because I've been out of education for a few years. So getting back into how to study and write assignments was really, really helpful, and the tutors were really great as well. And the UCAS application, I struggled with my personal statement. I wasn't sure what to do, where to go with it. So I did a lot of research, looked around what they were looking for, and you do just, if you're passionate about wanting to be a nurse, either side, mental or adult, it will come through in your personal statement. Just really fill it with everything that you're good at, like, you know, like she said, whatever skills you've got, apply them to how it would help you to be a nurse. And if you can, you know, if you can get some experience in a care home, volunteering in a hospital, whatever it is, just to get a little bit of, you know, experience working in that profession, it, you know, it really will help you. But use whatever you've got around, your family members, friends, people who are doing this course. You know, there's so much information and help out there, to really use whatever you can. And if you want it enough, you'll get there, definitely.
That's brilliant, Emily. Thank you.
Yeah.
Yeah, and like you say, just talking to people who are nurses, and talking to people, maybe if you can get them, who are currently on the program as well, which is why it's great to be able to have both of you here today to speak. I wonder if you could just maybe say a little bit about the course. I mean, you're coming towards the end of your first year. I know things have changed, you know, dramatically for you guys in first year. But even that aside, maybe you could just tell us a little bit about your experience of starting at the university and the course, and what it's been like since for you, in terms of the support you're getting from staff and lecturers, what the workload's like, you know, and what the teaching and the learning is like, and you have been on practice learning, and maybe a little bit about your experience of that. So Sinead, maybe you want to go first?
Yeah, definitely. Well, as I said, you know, the course is like no other course. So, you know, a typical heavy week for me would be, you know, I would be in on a Monday, Tuesday, normally maybe one day off, but, you know, you're using that day to do your assignments. You know, you really are. Luckily enough, when we started, it was 3 modules, you know, but now it's 2 modules, and your other one, they're going to use placement on like a pass fail, which is, you'll not realize how good that is. You know, you'll cover different topics. Like in first year, we done, you know, one about your biology, and if you're not very sciencey, don't worry, because I wasn't, and luckily enough, the tutors helped me so much. Like, to see your studies advisor, they are there to help you. Like, you email them and I guarantee they will get back to you so quickly. You can ring them, they are just on your side, and don't forget that they're on your side, especially because I was coming from A level and everybody always said, you know, you're not going to be spoon-fed in university, get used to having no help. And the help is there for you, especially in this course, you know. You know, tutorials are obviously a big thing, you know, and you're split up into groups. So I know it's daunting going in and thinking, how am I going to look at 300 people? But you're split up and you'll know everybody in your group, especially in mental health. We are such a close group. There's about 50 of us and we're so close, and we would do things outside of university. You know, we have a group chat, we would go and do quizzes and stuff. You know, it is so good. Obviously, placements are such a big thing. It's 50% practical, and they will run through Christmas and they'll run through summer, and you know, that is just a big part of it. You know, your friends might be off around Christmas and you might still be working, and that is very demanding. I can't deny that. But the reward that you get back from this is just amazing. It is so rewarding. So it is. And another thing we have in the week as well, now I'm talking about it, is the practical skills, which is where you would learn to do, you know, your injections and your CPR, and they are so fun. It just really gets the group together. So it does. It's just amazing. It is a full-on course. It is very busy. You're doing a lot of different stuff, but it is just so rewarding.
That's great, Sinead. Thank you. And as you say, the practical skills are a big part of it as well. And it is where you can be in smaller groups. And yeah, it's nice to hear that it's fun as well. There's fun in the learning. What about you, Emily?
Yeah, I would definitely agree with Sinead that it is daunting going in. You know, I didn't know anyone going in, and the thought of 300 people, and you don't know what experience they've got and you know what knowledge they've got. But I promise you, your tutors are a godsend. Like I said, they are so knowledgeable about all their specialist subjects, and if they don't know the answer, they will find it for you. They will put you in touch with someone. So really use them, and they give you everything you need to pass your modules and to pass your exams. So they'll give you reading lists and they'll give you specific chapters. So do the reading. Like, if you take nothing away from today, do the reading, because they are giving you what you need. Yeah, it's self-directed, so you know, you've got to go looking for the book, you've got to go and do the work on your own, but you aren't on your own. You have your tutors, you have your students around you, so really use them. You know, have a really good support network. I'm blessed. I have a really good family. I have really good friends. And I'm not afraid to ask if I'm stuck on something. If a tutor said something and I'm not sure what I mean, you know, don't be afraid to ask them. They are more than happy to go over it. And if you're putting in the work and you're putting in the time, they will give you it back tenfold, I promise you. And it's so rewarding. The skills days are brilliant. They are honestly a lot of fun, because it's you know, you are hands-on, you're working with each other, you do have a laugh, like Sinead said. Like, honestly, it is good fun. It's intense, it's hard work, but it is very rewarding. You know, nursing isn't like another degree. It is all year, but that is nursing, and that's what you're going to go into. That's the job. So yeah, you might miss out on a couple of Christmases and some birthdays, but working with the patients and, you know, getting to know them and their families is just incredibly rewarding. And it's, you know, it's why I want to be a nurse, and I'm sure it's why you all want to do it as well. But yeah, definitely, you know, look after yourself as well. You know, take time out. You know, have whatever you do to relax, you know, do that at least, you know, once a week, just to keep yourself sane, because it is intense. It's a lot of work, but I promise you it will all be worth it when you know, when you graduate and you go into working as a nurse in whatever field you want to go into.
That's great, Emily. Thank you. Yeah.
Hi, Stephanie. Sorry, I just want to jump in here now with a couple of questions that have come through the chat, just with the remaining time we have. Some I've been unable to answer. So I'm just going to shout them out at you here. So in the current situation, how can you get relevant work experience?
Okay, in the current situation, I know it's difficult probably to get work experience currently. You may want to look at voluntary organizations. I know people are looking for volunteers, and any work you do, really, you don't have to be directly doing nursing care. So anything you do voluntary, even if it's, you know, driving or delivering or something like that, anything you do, you're learning skills, and that sort of work can be helpful, and you know, you can learn from it, and you're helping people in a different way, but you're still helping people. So you can use things like that to, you know, be included in your personal statement and as part of your application. It's the skills that you're developing from that, whether that's communication skills, organizational skills. You're still going to gain things. So don't always think that it has to be direct nursing care type of work experience that you're getting. You can gain so many other types of skills from other types of work as well. So nursing care type of work is excellent if you can get it, and it gives you an insight into what the world of nursing is like. But don't feel that because you can't get that you can't apply. So any sort of voluntary work that you're doing will be very, very useful as well.
Okay, next question, Stephanie. Are there any health conditions that would prevent you from passing the health assessment?
Well, it's always on an individual basis, and it's about putting everything into context and trying to maybe achieve, you know, make amendments as required to allow you to study and to allow you to be able to practice. I couldn't really say. It's just taken on an individual basis, really. We've had students with different conditions, different health conditions, and they've managed. They may need a little bit of extra support, and we may have to put some amendments in place if we can. You know, we talk about reasonable adjustments. So, you know, we look at each case individually.
Okay, next question, Stephanie, and maybe one for the students. How did the students prepare for the interview? What is the interview format?
Okay, the interview format, and I'll let the students come in as well, but the interview format currently is a face-to-face interview. So you would, there's two people on a panel, usually one of the academics from the university and one of our practice partners, so a nurse from clinical practice. There's five short questions. This year we actually had to send the questions out to our candidates and ask them to produce a video of themselves answering the questions, because we couldn't bring anybody onto campus at the time of our interviews. Lockdown had happened. Very, very simple questions are asked, and you just give your answer, and we score them accordingly. I don't know if the students want to come in about their preparation. You've kind of mentioned a little bit.
I would just refer back to the point you made earlier, not to be afraid if you don't have any direct nursing care. You know, in my interview in particular, I remember talking a lot about how, so like, obviously I only had care for a family member, but I talked about a lot about my part-time job. You know, I worked in Tesco, you know, developing teamwork. I talked about how I've been in drama groups, and there's people in them groups with additional needs, and you know, it's just adapting all your life experiences to skills that can be useful, and just showing your potential and your willingness to learn, really. So it just would be, you know, zoning back on, don't be afraid if you don't have that experience, especially with what's going on at the minute.
Yeah, thanks, Sinead.
Yeah, definitely same as Sinead there. Just do your homework as well before you go in, you know, look at you know, what the hot topics of nursing are, you know. Obviously when I was doing it, was like staffing shortages and things like that. So how, you know, how you would deal with that, and just researching it first. Just do your homework. You'll be fine.
Okay, thanks guys. Just a few more questions here. So one from Nuala, Stephanie, that you might not be able to answer, but probably just mention it for the benefit of everybody anyway. Is it likely that classes will continue online come September?
Yeah, I would. We're planning at the minute for September, and yes, we're obviously taking the government advice and the university advice. So at the minute, we are planning that they will be online. We'd love if we can come back into the university, and if we can, we may have to maintain social distancing and you know, follow the guidelines. So we're planning for that as well.
Okay, and last question for now. So there are no role play scenario questions at the interview?
No, there's no role play scenarios. No, our interviews are face to face at the minute, and they're just 5 questions. And the first one is usually, why do you want to do nursing? And the questions follow things like, what qualities, you know, do you have that you think would be useful in nursing? Those sorts of things. There's nothing tricky about it at all, or no scenarios or role plays at the minute. We're constantly reviewing our recruitment and selection and the way we interview. And as I say, we've had to go and ask our candidates to provide videos of themselves this year, and we're just reviewing that process now and how that worked. It could be something that we might continue next year as well. But again, we will keep people informed about that all the way along, and we'll have information as it comes through on our web pages as well.
Okay, thank you, Stephanie. So guys, now is the final opportunity for any questions you might have for either Stephanie and the School of Nursing team, or the nursing students. So I'll allow a couple of minutes for that, but just in the meantime, Stephanie, Emily and Sinead, do you have any final thoughts you want to impress upon everybody here today who's listening about the role of nursing and what can be learned at Magee?
Well, I'll start off and I'll let the students come in then. I think nursing is very much in the spotlight at the minute. It's very appropriate, as I said, because it is the year of the nurse. And I think it's important that, you know, it's a highly, you're a highly qualified person, you're a professional when you're a nurse, and you're in high demand as well. And you know, we're very cognizant of all of these things, and we try and reflect this in our nursing programs as well, and while maintaining that person-centered, compassionate caring as well. I don't know if the students want to say anything.
Yeah, just that you're getting everything out of this course. You're getting a degree, you're getting a professional qualification, you know, there's no fees, you're going to have excellent employment opportunities and a great future ahead of you.
Yeah, so the first week of the degree last year, one of the tutors said, write down on a piece of paper why you want to be a nurse, and every time it gets hard, look back at that piece of paper and just remind yourself why you're doing it, because it will get hard and you will cry and you will have breakdowns in the library, but it will all be worth it. Just remember why you're doing it.
That's an excellent answer, guys. So a couple more questions have come in the meantime. So if anybody doesn't have any further questions, that's probably it for the webinar. Unless you do have questions you'd like to ask Stephanie and the students. So just cracking on with the questions then, Stephanie, would the course be too demanding for someone with children?
Oh, absolutely not. It is demanding, but it won't be too demanding. 40% of our students are mature students, and they have children. They have to juggle. They're very efficient with their time, and they get through it and they do fantastically. again, if you can come to our Insight event, even if it is through a webinar, we will have more students there that you can talk to. There'll be more time for discussion and talking. And yeah, you know, if you listen to any of those students, you know, they've done fantastically well. They need the support. They need good family support helps. But we do our best to support them as well. Absolutely.
Okay, next question. What should be avoided in a personal statement or during the interview?
There's nothing really to avoid, just be yourself. Know, as our students Emily and Sinead have said, know why you want to do nursing, and really think about it, and think about your own qualities and what you have, what's important. So you need to know, you know, what the role of a nurse is, and hopefully we've highlighted some of that role for you today. But knowing what the role is, what those qualities are that are required, and what you have, what you can bring to that as well.
Okay, and in terms of number of places, how competitive is mental health nursing? Can this lead to opportunities to both work with adults and children?
I don't know if Claire McGlowan's on the line. Claire, if you can.
I don't think she is, Stephanie.
Oh, she might have had difficulty coming on.
Mm-hmm.
I think it is competitive for mental health nursing. Obviously, the commissioned numbers are smaller for mental health nursing, but it has been increased significantly this year. So we've got 20 extra places for mental health, which is kind of reflective of the commitment of the department to focus on mental health nursing. And obviously, you know, there's a lot of opportunities within mental health services as well when you're qualified as a nurse in mental health, that you can specialize in or go into. So it is quite competitive as well.
Excellent. Okay, I think that's enough time for today. We're well over time, but that was a really well delivered webinar, super popular, our most popular so far, and I hope it gives everybody an insight into what the nursing degree is like at Ulster University. So if anybody does have any further questions, you can get us online on our website, or contact us at study@ulster.ac.uk. We hope you join us for more webinars, but we will send this webinar recording out to all attendees so you can watch it back at your leisure. So a big thank you to Stephanie Dunleavy and Emily Howe and Sinead Rocks for attending and supporting today. And we hope to all see you again in future webinars. So thanks very much, everybody. And thank you, Stephanie.
Thanks.